Edema versus fibrosis. What are they, and does it matter? Hey everybody, Tim Weyant, clinical specialist here with the Aspen After Surgery Center. We are shooting a video today on edema versus fibrosis. We've been getting a lot of requests lately on explaining the difference when we're talking about our liposuction fibrosis and we're talking about scar tissue. So let's dive into this and talk about the difference between edema and fibrosis. It's basically an order of action. So let's talk about what leads to what. Essentially, edema, uncontrolled, leads to fibrosis. Edema in its most basic definition or sense is basically swelling. Edema is when we get fluid in a tissue that swells and causes that tissue to fill up more than it normally is used to. So think of it like a balloon. Too much swollen becomes a problem. Edema can be anything, and the name edema versus swelling is interchangeable. They're basically the same thing. Edema is just the medical name for swollen. So why do we get edema? Edema is basically a result of trauma, injury, accident, surgery, and a couple other medical conditions that can create this edematous swollen area. And it can be anywhere. It can be in tissue, it can be in muscle, it can be in any part of our body, right? Somebody gets hit, their face swells. Body part has surgery, knee surgery, that tissue swells up. So swelling is basically just fluid that gets stuck in the tissue. Now, why is this a problem? Well, the reason why edema is a problem is when edema is left to sit for very long periods of time, it creates sort of a cocktail or a recipe of ingredients that cause the tissue around it to change. And this change can be scar tissue, adherence, tissue limitations in movement, hardness, or scar tissue. Well, edema then becomes fibrosis. So when something is edematous or swollen for a very long period of time, those chemical changes turn what would be either good tissue or tissue that's trying to heal into fibrosis. So fibrosis is basically scar tissue. So if you take a look on the diagram here, you'll see here it's kind of like this haphazard pattern or mesh of tissue. Well, tissue that's smooth and soft that moves tends to be parallel, and it moves by itself very easily. It stretches, it moves. But fibrosis is when the tissue kind of gets all messed up, okay? Think of it like a ball of twine that's all wrapped up and lumpy and knotty. So essentially, edema, swollen, left long enough in any area of the body or tissue turns into fibrosis. So why is this important? Well, we want to manage the edema. So any doctor, any surgeon, any rehabilitation specialist will tell you that you cannot manage tissue until you manage the edema, right? So people who have knee replacement wear compression stockings, right, to get the swelling out of the knee in order for their knee to start moving better and to prevent scar tissue from building up. Well, the same thing happens in cosmetic and plastic surgery. So whether you're having a facelift, whether you're having a tummy tuck, or whether you're getting liposuction, which is basically sucking tissue out of the body, which is extremely traumatic, that creates the edema that then turns into fibrosis, and the fibrosis becomes a problem because it changes the appearance of the tissue. It makes things lumpy. It makes things bumpy. It creates that cottage cheesy sort of rippled effect, especially on the areas of the abdomen or the face or even the extremities. So we want to properly manage edema before it turns into fibrosis. So how do we do this? Well, number one, good compression garments. Compression garments is an outfit that a patient should be wearing after your procedure. Now, the problem with garments is we really don't know what the right type of garment is or the size of the garment, because typically when we have our procedure, you may be given an off-the-shelf type of garment, or for tummy tucks and liposuction, we see a lot of those white Velcro binders. Those white Velcro binders are absolutely horrible because they create a ridge above the binder, they create a ridge below, and they also pocket and pool the fluid in the center area, creating almost like a tourniquet effect. So rule number one after any cosmetic procedure is make sure in advance that you book with a local fitter, orthotics, prosthetics, or custom garment Buzzword is fajas, so this has been brought up from the South American community, or a faja, so either a compression garment or a faja, the trick being professionally fitted. So not just a medical supply store that you grab a box off the shelf, or somebody goes, here's a garment and hands it to you, but it needs to be fitted, it needs to be measured. So prior to surgery, it's real important, get a pre-fitting for your garment and have it ready to go. Now the rule of getting a garment is it has to cover the area above and below the area that you're having the procedure. So for example, if you're having a tummy tuck or you're having liposuction, your garment should go above the tummy all the way to the shoulder area, and it should also go all the way down to the knee area. This way you have proper compression, fitting properly, and it helps push that swelling out. So we have our surgery. Swelling begins, we have edema, and we want our compression garment because our compression garment is going to push that edema out, away, back into the body so the heart, the blood vessels, the lymph vessels can all excrete that and get rid of it. So, second step, now that we got our garment on, there's some additional things we can do to manually push that edema out. That is called lymphatic drainage. Now, this in the industry tends to be very confusing for patients because we see all kind of funny wood tools and devices and garments and cavitation and all kinds of devices that are being used out there, and they're claiming that it's good for lymphatic drainage. So as a licensed physical therapist practicing 22 years and an expert in lymph drainage, I can tell you, lymphatic drainage massage does not even seem like a massage because it is very light. It is a very soft technique in which the clinician's hands will move that fluid throughout the patient's body, and it almost seems like, why am I paying for this? It doesn't even seem like it's working. It's because it needs to be that gentle in order to be effective. So, second rule of post-op preventing fibrosis is to do manual lymph drainage. Now, the person providing this is important. So no different than you want your medical doctor to have an MD or a DO behind their title, you want your lymphatic specialist to either have an MLD or a CLT behind their name, or show you a certificate that they are a licensed manual lymph drainage therapist in order to get the right treatment. Because remember, if we don't manage our edema, it's going to turn into fibrosis. So step one, we know now to wear a custom fit garment. Number two, we know to do manual lymph drainage. Number three, fibrosis prevention. So there are a number of products on the market that work with swelling, edema, and bruising. Arnica montana is one of those. There's a whole host of other things. I won't get into it. But it's a good idea to take products or herbs or supplements that are specific in reducing swelling, edema, and bruising. Very important to help the body heal, flush, and wash out. And I also recommend drinking more water than you normally do. So there's no exact amount. So people say, Tim, you know, how many glasses a day? It doesn't matter. If you only normally drank 1 or 2 glasses a day, drink 3 or 4 glasses of water a day, because the water goes into your body, it lubricates your tissue, and it helps the blood vessels flush out all those bad toxins and all the things that are causing the swelling. Okay, now, what happens if we did all three and we still have fibrosis? So my patients call me up and they go, Tim, I had all these lymphatic massages and I'm still having the fibrosis, and my lymphatic therapist is telling me I need more lymph drainage. Well, I professionally disagree. The reason why that was because the lymphatic massage was supposed to prevent it, but sometimes the fibrosis builds up faster than the lymphatic drainage, or you just didn't have enough sessions. Once fibrosis occurs, you cannot use lymphatic drainage to treat fibrosis. I'm going to repeat that, and I'm going to highlight this. You cannot treat fibrosis with lymphatic drainage because it's too late. So what can we do? Well, that's where we come in. The Aspen After Surgery Center can provide treatment for fibrosis where we use very specific technologies, specific hands-on techniques, and specific tools that are designed to treat fibrosis by essentially taking this matty, knotted up ball of tissue that's all clumpy and lumpy, basically breaking it up, stretching it, and getting those fibers back into a parallel alignment instead of this crazy little ball of scar tissue. So anybody who has any questions regarding preventing edema, compression garments, or God forbid you get fibrosis, regardless of what you have. It could be a facelift, it could be tummy tuck, it could be liposuction. Give us a call here at the Aspen After Surgery Center. Remember, we offer virtual evaluations, so you could be anywhere in the world, and we can talk to you, assuming it's not like 2 in the morning here, because, you know, nobody wants to be woken up in the middle of the night for a virtual, but we can schedule for a virtual. Take a look at you, look at the tissue, do a proper evaluations with a licensed medical professional who is a post-op plastic and cosmetic surgery specialist, and get you the information or at least a second opinion to say, hey, this is what you got, this is what we should do, or even if we can't help you, can lead you in the direction of how to get help with your issue. So everybody, take a look at the 877 number on the banner below, give us a call, send us a DM, reach out to us, and we'll be happy to have you here at the Aspen After Surgery Center.